A very common question that people ask about abdominoplasty surgery, also known as a tummy tuck, are my muscles going to be repaired during the surgery? That is actually, to me, not the right term for it. We're not repairing the muscles. I'm going to show you what's actually going on anatomically, and it's something called a diastasis. So what does a diastasis mean? It means a gap. So especially when someone has had children, especially twins, especially multiple pregnancies, here are your, what I like to call sit-up muscles, okay? Your rectus abdominis muscles. And those, there's a gap between them. So it's basically everything gets stretched out when you're pregnant. What I like to say is everything goes out and then goes down. So there's this gap between the muscles, but the muscles themselves are not torn. There's a gap. And you may notice this when you do a sit-up. You may notice that your belly button is more bulgy than it was. And that is all from this diastasis. It comes out through there as well. So during the surgery, what I do is I correct the diastasis above and below the belly button. So the muscles are in an anatomic position. So not only is your waist more of an hourglass shape because everything gets tightened, kind of like an internal corset, it also changes the way your core muscles work. So one big wonderful thing that happens with the tummy tuck or abdominoplasty surgery is that it can help lower back pain and also increase core strength. How does that happen? So these are a different view of the muscles. So imagine I cut you all the way in half, kind of like a magician. So this is looking at it before surgery. Now this black is that diastasis, that gap again. Now you could see on this diagram, when you're activating those muscles, including your lower back, it's missing here, right? Because the muscles aren't working in the front where the diastasis is, and this puts more pressure on your lower back. Now, after I do the repair, which happens here, all of a sudden you have a complete cylinder and your body can really hold that core strength much better. And this is something that can't really be fixed with exercise. So it doesn't matter how many sit-ups you do, if there is an anatomic disruption in the position of your muscles, sometimes in fact, exercise and sit-ups can make it worse. So this is just a fun thing that's part of a tummy tuck. So little description of why what we do is important anatomically.